Masteron at 600 to 700 milligrams per week represents an extremely aggressive dosing protocol that pushes the boundaries of performance enhancement. This dosage goes far beyond therapeutic or even typical bodybuilding applications, entering territory where the drug's anabolic effects become maximized while its health risks escalate dramatically. At this level, Masteron produces profound physical transformations, but at a significant cost to multiple physiological systems, requiring careful consideration of both its benefits and dangers. The drug's DHT-derived structure creates unparalleled hardness, making muscles appear as if carved from stone. Subcutaneous water retention virtually disappears, revealing striations and vascularity that would be impossible to achieve naturally. Masteron at this dosage fundamentally alters how muscle tissue presents itself, creating a three-dimensional quality to the physique that catches light differently under stage lighting. The drug's impact on collagen synthesis enhances this effect, making tendons and insertions more visible. These dramatic visual changes come at the price of increased joint stiffness, as the near-total absence of subcutaneous water reduces natural lubrication between tissues. Competitive bodybuilders often use these doses in the final weeks before a show to achieve that ultra-dry, grainy look where every muscle fiber stands out distinctly. The drug's anti-catabolic properties preserve lean tissue even under extreme calorie deficits, making it invaluable during contest preparation. However, this same property creates a dangerous situation where users may push through pain signals that would normally warn of impending injury, leading to overtraining damage that becomes apparent only after the cycle ends. Hair loss accelerates to alarming rates in those genetically predisposed, with many users reporting visible thinning within just 2 to 3 weeks. Unlike the gradual loss seen at lower doses, this level of exposure can permanently damage hair follicles, making regrowth impossible even after discontinuation. The lesions often leave permanent scarring due to the intensity of the inflammatory response at this dosage. Body hair growth becomes excessive, with many users noticing thick, dark hair appearing in places they never had hair before. The psychological androgenic effects include extreme aggression and competitiveness that, while beneficial in training, can damage personal relationships and lead to reckless decision-making, muscle hardening, and physique enhancement. The improvements come not from massive increases in muscle size, but from enhanced neuromuscular efficiency and improved energy utilization within muscle fibers. Explosive power sees particular enhancement, making this dosage popular among strength athletes during peaking phases. At 600 to 700 milligrams weekly, Masteron's effects on muscle density and definition become extreme. The hypothalamic pituitary testicular axis becomes so suppressed that recovery may take 6 to 12 months even with aggressive post-cycle therapy. Testicular atrophy is rapid and severe, with many users experiencing 50 to 60% reduction in testicular volume by week 4. The changes in body composition go beyond simple fat loss. Cortisol levels become chronically elevated while thyroid function becomes suppressed, creating a metabolic environment that paradoxically limits gains despite the massive androgen load. The adrenal axis becomes so dysregulated that many users require medical intervention to restore normal function post-cycle. HDL often drops to single-digit levels, while LDL skyrockets above 250 milligrams DL. This creates an atherogenic environment that accelerates plaque formation in arteries at a rate normally seen only in genetic lipid disorders. Liver enzymes often elevate to 3 to 5 times normal levels, indicating substantial cellular damage. The withdrawal phase brings even worse psychological effects, with many reporting suicidal ideation when attempting to discontinue use. The contrast between the superhuman on-cycle feeling and the depleted down-cycle state has driven some individuals to self-harm or relapse into steroid abuse. Users frequently experience extreme mood swings ranging from euphoric confidence to debilitating depression. Cardiovascular damage accumulates silently, with autopsy studies of former users showing arteries resembling those of elderly lifelong smokers. Hair loss often becomes permanent in predisposed individuals. The endocrine system may never fully recover, leaving users dependent on testosterone replacement therapy. Sleep architecture becomes severely disrupted, with many reporting insomnia and night sweats. Cognitive function shows paradoxical effects while gym focus and motivation increase. Higher reasoning and impulse control often deteriorate. The dramatic physical transformations and performance enhancements create a high that many users struggle to replicate naturally, leading to dangerous patterns of repeated use. The muscle built during these cycles often comes at the price of decades of health and quality of life. Weekly blood pressure monitoring becomes essential, with many requiring antihypertensive medications. Regular blood work to monitor liver enzymes, lipids, and hematocrit is non-negotiable. Post-cycle therapy must be aggressive, often including HCG, SERMs, and sometimes even low-dose testosterone to bridge the gap until natural production resumes. The kidneys face increased strain from elevated blood pressure and protein metabolism, with some users reporting changes in urinary frequency and color. The sheer volume of oil can lead to injection site reactions and scar tissue buildup. Many users rotate between multiple injection sites to minimize tissue damage. Hematocrit levels commonly surpass 55%, turning blood into a sludge-like consistency that dramatically increases the risk of stroke or heart attack. These cardiovascular effects become particularly dangerous when Masteron is stacked with other steroids, as is common at these doses. The changes persist for months after the cycle ends, suggesting permanent damage to vascular health. Strength and performance effects. Strength gains reach their maximum potential at this dosage, with users often adding 30 to 40% to their major lifts over an 8 to 10 week cycle. Recovery between workouts becomes nearly superhuman, allowing for daily intense training sessions that would overtax natural athletes. Androgenic side effects and their consequences. The androgenic effects of Masteron become overwhelming at 600 to 700 mg weekly. Acne develops into severe cystic eruptions, particularly along the jawline, back, and shoulders. Now, cardiovascular strain and health risks. The impact on cholesterol profiles becomes catastrophic at this dosage. Blood pressure routinely exceeds dangerous thresholds, frequently reaching 160/100 mmHg or higher. Endocrine system suppression and recovery challenges. Natural testosterone production shuts down completely within days of starting this dosage. The lack of estrogen conversion means users don't experience water retention or gynecomastia, but they face equally problematic endocrine issues. Liver and organ stress. While Masteron doesn't cause direct liver toxicity like oral steroids, the metabolic demands of processing 600 to 700 mg weekly create significant hepatic stress, psychological effects, and behavioral changes. The neurological impact of high-dose Masteron use is profound. Some users develop a hypomanic state characterized by grandiose thinking and risk-taking behavior, long-term health consequences. Chronic use at these doses leads to permanent changes in multiple systems. Perhaps most concerning is the psychological dependence that develops. Practical considerations and risk management. Users venturing into this dosage territory must implement extreme precautions. Injection frequency becomes burdensome, with users of the propionate ester requiring daily injections to maintain stable blood levels.